Hey guys, what's going on? So, quick video, quick clinical update because my videos have been running late and I know I'm behind. But yeah. So, clinical update number 6. What I had to do actually was medication administration. And I'm not gonna lie, when my professor decided that she was gonna have me administer drugs, I was nervous as hell because when my two friends had gone the previous week, it was just like really intense, stressful. You didn't know what to expect exactly. I heard that, we had to look up all the drugs, get all the, what the drug was used for, all the side effects and any precautions, whatever. I thought I would need to know that off the bat. I thought I was going to get the hell quizzed out of me. And I thought my professor was just going to kind of, go in. She actually didn't. Was nowhere near as bad as I thought I did. I honestly had my anxiety so high. That was my biggest barrier. Like, my own nervousness was what would have prevented me from actually giving my drugs well. But once I started going through the process and getting into it, I actually calmed down. So, my patient was 78. She actually came into the hospital with a fractured femur and hip. She's end stage COP. She was just completely, she was a mess. And she was actually a DNR, DNI, do not resuscitate, do not intubate. And surprisingly, even though she was sitting there with so much, her feet and ankles were so edematous, like she was building up so much fluid and she was in so much pain. She did not let us know that at all. I mean, okay, she didn't voice it anyway. You could tell she had grimacing on her face, and when we turned her, because we had to clean her, we provided her hygiene. That wasn't my goal. My goal was strictly to give her drugs, but I did assist my friend in giving her hygiene, making sure she ate. She was on a strictly fluid diet, strict INO, and what she received was called, it's thickened fluids. So they would put a powder into her orange juice and her milk, and it would thicken it up so that she could swallow it because she was an aspiration risk. And the lady just really, she was the most pleasant DNR patient I have ever met so far. And I mean, I haven't had many patients, but she was really just really nice and really calm and strong, very strong. Um, so what I had to give her, actually, I gave her Protonix, which is pantoprazole, aspirin, Senna and Colace. I gave her, and with those I crushed them. I gave her Feosol. I'm not gonna tell you guys the generic term because I can't remember it right now. And I gave her Lovenox sub-Q. So I crushed some of her meds and put it into pudding for her. And the Lovenox she got sub-Q in her lower right abdomen. Um, and I actually administered my drugs well. My professor was proud of me. I thought I was gonna be shaking. I thought I was gonna be nervous as hell. Um, I thought I was gonna hurt him when I put the needle in. I'm thinking she's in so much pain as it is. I don't want to inflict any more pain onto this woman, but I succeeded. I was, and I actually got to give another sub-Q injection later that day to another patient. And what I will say is the more you do it, the easier it gets. Because the first time I was shaky and, I did it well, but I was shaky. I guess that was just me on the inside. But the second time I did it, I was definitely more confident in the procedure and how I was going to carry it out and, locating certain things on the body to help me properly administer the medication. So, practice makes perfect. I can definitely say that. It's definitely one of those things. And I know as I administer more medications, it'll just get easier and easier. Because you watch these nurses in there and they're drawing it up and 1, 2, 3, wham. And I'm like, I was like, that was quick. Like, it's like that. They got it like that. So, practice makes perfect. I know one day I'll be there. Um, what else happened in clinical that was really good? Aside from that, oh, my patient, she was really a phenomenal woman. And her husband came in and they've been married for, I think it was something like 50 or 60 years. And he was so lost and confused Oh my gosh, he came in, such a sweet man, and he's like, I was running late because I had to call the insurance company and I had to call this other bill company. And he's like, I didn't know what to do. I had to ask them these questions. I was like, she does everything. He's like, I just go to work, I give her the money, she pays the bill, she takes care of the house. And you could tell they just had such a strong bond because she kept asking for her husband. And she's like, where is he? Where is he? And I mean, we didn't know where her husband was. We were hoping that he would show up, and he did finally. And their relationship was just so powerful, and it impacted me a lot. I can only hope that in the future I can have such a long lasting, caring, compassionate, honest, everything under the book, God blessed relationship. I can only hope because they are truly blessed. And I mean, aside from that, I know when I go back this week, she probably won't be there. Actually, I know she won't be there because they were preparing her for hospice. So, they didn't know if they were gonna do it in the hospital or in her home. But, yeah, that was about it. I mean, I got to give her her meds. Couldn't do an IV push, but, I got to watch that done. Like I said, the nurse was really just, whew, 1, 2, 3, done. It's like, okay. But going through the whole process, thinking about it and learning about it makes you so nervous. And then when you get in there and you do it, it's like, oh, all the medications already pre-drawn up. Everything is pre-dosed. Didn't have to calculate anything. The worst case scenario is actually, well, I had pre-drawn syringes for her Lovenox. The worst case scenario is you'll have to draw it up, maybe draw up insulin or something, or heparin or something. That's the worst thing that you could possibly have to do. And I thought it was gonna be, I was like, do I need a calculator? Am I gonna have to sit here, like, do I need to, write things down and add this and subtract that and multiply that and divide? There's nothing like that. It's so much easier than what they make you think it is. And I mean, I know it's definitely just hospital technology growing and developing, and it's not like back in the day where, yes, everything was calculated right there on the spot. But it's so much simpler than what you're learning. So have no fear. Learn it, get through it, know how to do it, and then when you get in the hospital, it's a piece of cake. I think that's it. That's all I had to talk about for right now. Bear with me and my videos being so late and broken up and all this stuff. It's crunch time now. The workload is getting a little crazy for me. Midterms and everything coming up, and I'm just trying to still do this. I have a lot of other video ideas. I just haven't been able to get to them yet. So I'm just trying to make sure I keep up with at least the clinical stuff for you guys. Aside from that, I know I do have a couple video requests, and I will get to those as soon as I humanly possibly can. Other than that, later guys, until next time, okay? Bye.